In 1978, I completed a master's in nursing from the University of Pennsylvania and became a nurse practitioner in women's health. I took a position in practice with three OBGYN medical doctors. That meant I had my own population of female patients to see in the office every day. Our office was directly across the street from the hospital's emergency department. I wanted to work with victims of rape. I wanted to help them in the immediate aftermath of the crime. I had developed helpful skills in my NP program, but there was more to learn. Therefore, I spent time with victims at the Philadelphia Center for Counseling Post-Rape. I spent time at the medical examiner's office learning about types of injuries. I spent time with the forensic psychiatrist who taught me how to write reports for the courts. I spent time with police learning about evidence, and I went to a crime laboratory for information about how to collect evidence properly. After all of that, I felt ready. I got my first call in the middle of the night at about 3 a.m. I was tired. I had to start working in the office at 9 a.m. My first thought was, what am I doing? I prepared with new skills and information, but had not considered the time of day when this kind of victimization takes place, most frequently. I got to the hospital quickly and met my first woman in need. Clearly, she was frightened by the appearance of the emergency department. The waiting room was crowded and loud, with terribly uncomfortable seating. I took the young lady back to an exam room as quickly as I could. I realized that the first thing to do was reduce her anxiety. We talked for a bit about nothing important, and I offered her a warm blanket she gratefully accepted. I introduced myself and the process. She introduced herself as Patty, a new college graduate working on her very first job. I made sure she was aware that she could ask questions at any time and that she had the power to stop what I was doing at any time. She did use her power to stop the questioning a few times, asking for clarification. I reasoned she'd been through an experience that removed her power completely, and I wanted to give it back. I asked her if she wanted anyone with her for the examination. She said no. Nurses are neutral, unlike the criminal justice system that's very adversarial. I did my best to offer Patty choices as often as possible. For example, do you or do you not want to report this crime to law enforcement? This is a big question that requires patience to navigate. Some women want to report to police and some do not. I stay neutral. The victim decides on the reporting. She seemed to appreciate being given the power to choose, and within 5 minutes, she seemed much more comfortable than she was when I met her in the waiting room. The examination has spots that are uncomfortable, and together we worked through them. She used her power to stop the process a few times, and I acquiesced each time. She required lots of explanations about what I was doing, but was completely cooperative and explained to me, given her control over the procedures, helped her to relax. I was so worried about saying and doing everything perfectly that I was tense. But when she was relaxed, I became relaxed also. We moved through the examination at the pace she set. After the exam came medications to prevent sexually transmitted infections and pregnancy. I promised her this traumatic experience would pass, and she would be strong and well again, and she would feel safe again. She will work through the trauma, I was sure. I referred her for counseling. We hugged again before she left. She cried a little, and so did I, though I did my very best to hide it. I called her the next day just to make sure she didn't have any lingering questions or concerns. She did have questions, and I answered them to the best of my ability. I never saw her again, but I can tell you I wish I had. I wish I could have told her how much the experience meant to me and tell her, after our visit, I wanted to keep doing this type of work for the rest of my professional life. She moved me from thinking, what am I doing, to thinking, I want to do this for my entire professional life. She proved I can do it, and I can do it well. Flash forward, I've cared for hundreds of women and men who experience rape. I've taught many nurses how to care for victims of rape in the immediate aftermath. I've helped write protocols for many programs, including the one here in Philadelphia. What keeps me going with this type of victimization is the obvious match of the needs to the skills of nursing. Caring, good interviewing skills, assessment skills, and teaching skills are all needed. Nurses keep up to date via education and practice. We're always up to date and always on time. Nurses are neutral compared to the legal system that is not at all. Perhaps most importantly, we lead with our hearts, see the needs, and bring our skills to the needs. I continue to help victimized people to this very day. I still believe in 2024, no other profession approaches victimized people with exactly what they need other than nursing. I'm proud to be a nurse and always will be. It's a real wonder. Something that happened in 1978 started a practice that continues to this very day. Patty, wherever you may be, thank you.